Hey Doc, it's Nick. I do think this is a case that you can do, and I think it'll make sense once I explain it here shortly. So patient wants the diastema closed between 8 and 9, obviously a very severe deep bite, uh, almost a full cusp class 2 sagittal relationship. This is not a Bolton discrepancy situation. I'm going to come over to the Bolton analysis. Yeah, about a millimeter Bolton mandibular excess. But I share this that it's not a pure Bolton problem because he's not coupled appropriately. In other words, he has a lot of overjet for us to solve the problem. So what I would do, when I say overjet, he has a lot of potential overjet. Obviously right now not so much, but you can see the potential overjet that's there. So there's a lot of room for you to procline the upper teeth and then close them without having an interference problem. This is without fixing the actual sagittal or skeletal malalignment. So what I would do is just offer the patient the following options. One would be referral to the oral surgeon for orthognathic surgery. I think that's maybe overkill for this, but I think it'd be good to at least offer that as option one. Option two is that you use Carrier appliance to fix the sagittal discrepancy. Definitely can do that. We might not get full resolution of the sagittal discrepancy, as is probably 6 millimeters. Carrier in adults, the max is probably 4 millimeters. That's kind of my working theory at this point. But let's see how much of a discrepancy he has. So we want that cusp tip to be in that fossa. So we're looking at 1, 2, 3, 4, maybe 5. Yeah, so we could definitely improve it dramatically. So option 2 would be to use a Carrier to fix the sagittal discrepancy. Option 3 would be to keep his molar relationship as is and just procline the teeth as much as we can and close the space. This would probably keep his overjet, his overbite more or less where it is. We're not going to get maybe that much intrusion of the lower teeth, but this would be a very good camouflage treatment option. So it's not as difficult of a case if we're not trying to fix the sagittal correction because of the fact that his deep bite gives you the potential overjet to close all of the space on the upper without it interfering with the lower. Therefore, it's an easier case if that's our treatment goal. So I would consider that. I'm happy to do the case with you. I definitely think with your experience in Invisalign, this is something you can do if the patient's goals are in alignment with this particular proposal, which is to not fix the posterior sagittal discrepancy, but only improve the anterior relationship of the teeth, closing all of the spaces on the upper, intrude as much as you can on the lower, and whatever resultant overjet we have, we try to have them coupled at the end, which I do not think will be a problem. Using Invisalign here, this is a pretty straightforward case. So let me know. Take care.